Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's class, I'm going to be treating the anatomy of the brachial artery. The brachial artery is the main artery of the arm, which arises from the lower border or the inferior border of the teres major muscle as a downward continuation of the axillary artery. In anatomy, a structure takes the name of the region that is passing through. When the subclavian artery, which arises from the aortic arch, crosses laterally to the axilla, it becomes the axillary artery. That is originating from the outer border of the first rib. Now, when the axillary artery enters the arm, it becomes the brachial artery because the arm can be called the brachium, originating from the lower border or the inferior border of the teres major muscle. So, without wasting much of our time, the brachial artery is an anastomotic artery. It is not an end artery because it forms the anastomosis around the elbow, that is the elbow anastomosis. So it forms majorly the contributions that unite with its branches to form the elbow anastomosis. So it is an anastomotic artery, not an end artery. An end artery are those arteries that supplies to a particular structure directly. But an anastomotic artery has branches that forms an anastomosis. So let's dive into the class properly. The first thing to note is the introduction. What is brachial artery? Brachial artery is the main artery of the arm, which arises from the lower border or the inferior border of the teres major muscle as a downward continuation of the word of the axillary artery. It terminates at the level of the neck of the radius. It's landmark. The level of the neck of the radius is the landmark. So the neck of the radius is the landmark because it indicates the termination of the brachial artery, which gives an origin of the ulnar and the radial artery. Okay, so that is the concept. Now, as you can see here, this is the axillary artery. This is the axillary artery, which enters the brachium to become the brachial artery at the level of the lower border or the inferior border of the teres major muscle. So this is our teres major muscle. Teres major muscle. Here is the inferior border or the lower border of the teres major muscle. So it's the landmark because it indicates the origin of the brachial artery. So here becomes our inferior border of teres major. Okay, now let's go into our origin. What is the origin of the brachial artery? The brachial artery originates from the lower border or the inferior border of the teres major muscle. That is the origin of the brachial artery. This is the origin because here is the axillary artery. At the level of the inferior border of the teres major muscle, crosses downward medially in the front of the arm becomes the brachial artery. So that is the origin. Inferior border or the lower border of the teres major muscle. Okay, go to the next one, which is the cause. The cause. What is the cause or how does the brachial artery runs? The brachial artery originates from the inferior border or the lower border of the teres major muscle. It gives off its first branch, which is the profundile brachial artery. Profundile brachial artery. Once it originates from the inferior border of the teres major muscle, it gives us a branch, which is the profunda brachial artery. Profunda means deep. It means what? Deep. As it gives off this branch, the profunda brachial artery, the profunda brachial artery crosses posteriorly in the arm. It crosses between the medial and the long head of the tricep brachii to enter the spiral groove or the oblique groove at the posterior surface of the humerus. As it leaves the spiral groove or the oblique groove, it divides into two terminal branches. The middle collateral branch and the radial collateral branch, which is the anterior and posterior descending branch. Look at it here. It crosses posteriorly in the arm, passing between the medial and the long head of the tricep brachii, where it enters the spiral groove, accompanied by the radial nerve, although it accompanies the radial nerve in the spiral groove. As it leaves the spiral groove, it bifurcates into two terminal branches, the anterior and posterior descending branch, which is the middle and the radial collateral branch. Okay, this is the anterior descending branch. Anterior descending branch, which is the middle collateral branch or the middle collateral artery. Okay, this is the posterior descending branch, which can be called the radial collateral artery. Okay, this is the two terminal branches, the descending terminal branches of the profunda brachial artery. So that is the cause. Now, once it gives off that branch, the profunda brachial artery, the brachial artery itself, this is the brachial artery. The brachial artery. The brachial artery itself crosses downward medially in front of the arm. It crosses downward medially in front of the arm to reach the cubital fossa, that is in front of the cubital fossa or the elbow joint. Once it gets to the cubital fossa, at the level of the neck of the radius, it terminates into two terminal branches. The larger terminal branch, which is the ulnar artery, and the smaller terminal branches, which is the radial artery. To tell you that the neck of the radius is a landmark because it indicates the termination of the brachial artery. Neck of radius. Level of neck of radius. This is the larger terminal branch, which is the ulnar artery. Larger terminal branch, which is the ulnar artery, and the smaller terminal branch, which is the radial artery. Radial artery. Smaller terminal branch. So that is all about the cause of the brachial artery. So we'll go to the next outline, which is the termination. The termination. The brachial artery terminates at the level of the neck of the radius, where it bifurcates into two terminal branches, as I've said earlier, the radial artery and the ulnar artery. The ulnar artery is the larger terminal branch while the radial artery is a smaller terminal branch. Okay, let's go to the branches. The branches. The branches. On the branches, we have the profunda brachial artery, profunda brachial artery, brachial artery. We have the posterior descending branch, the anterior descending branch, the superior ulnar collateral artery, the inferior ulnar collateral artery. So the branches of the brachial artery include the profunda brachial artery, the posterior descending branch of the profunda brachial artery, the anterior descending branch of the profunda brachial artery, the superior ulnar collateral artery, the inferior ulnar collateral artery, the deltoid ascending branch, which is its anastomotic branch, the deltoid ascending branch. Deltoid ascending branch. Deltoid ascending branch, which is its anastomotic branch. We have the nutrient artery, which supplies to the humerus through its nutrient foramen. Nutrient artery. We have the muscular branch. The muscular branch. Muscular branch. The muscular branch. So those are the branches of the brachial artery. The next we'll be discussing is the relation. The relation. The brachial artery has 4 relations. The anterior relation, the posterior relation, the medial relation, and the lateral relation. Now, on the anterior relation, it is divided into 3 parts. The anterior relation of the brachial artery is divided into 3 parts. The anterior relation. Anterior relation is divided into 3 parts. The upper part, the middle part, and the lower part. On the upper part, it is related to the medial cutaneous nerve of the forearm, which lies in front of it. On the middle part, it is related to the medial nerve that crosses it from the lateral to the medial side. On the lower part, it is related to the bicipital aponeurosis, which crosses it in the cubital fossa. So that is the anterior relation of the brachial artery. The posterior relation, the brachial artery successfully lies on the long head of the tricep, the medial head of the tricep, the coracobrachialis, and the brachialis muscle. On the medial relation, it is related to the ulnar nerve and the basilic vein on the upper part of the arm, and the median nerve on the lower part of the arm. The lateral relation, it is related to the very important structure. Number 1 is the biceps brachii, the coracobrachialis on the upper part of the arm, and the bicep tendon on the lower part of the arm. That is all about the relation of the brachial artery. Okay, the next we'll be looking on is the clinical relevance. The clinical relevance. The clinical relevance. On the clinical relevance of the brachial artery, we have number one, compression of brachial artery. Compression of brachial artery. Brachial artery compression is done at the level of the main shaft of the humerus. That is, at the point of insertion of the coracobrachialis. You get. The brachial artery can be compressed at that region to stop any hemorrhage of the upper limb. There could be hemorrhage in the superficial and deep palmar arches in the palm. It can be compressed at that region in order to stop the bleeding of the superficial and palmar arches. There could be either bleeding as a result of rupture or any mechanical injury. The brachial artery can be compressed at the region of the arm, at the level of the insertion of the coracobrachialis. Okay, the number two, we have the rupture of the brachial artery. Rupture of brachial artery. The rupture of brachial artery can be done by the supracondylar fracture of the humerus, which will lead to Volkmann's ischemic contracture. It will lead to what? Volkmann's ischemic contracture. Volkmann's ischemic contracture. The Volkmann's ischemic contracture will be implicated as a result of the supracondylar fracture of the humerus, which causes rupture of the brachial artery. The number three is aneurysm. Aneurysm. That could be abnormal dilation of the brachial artery, which could be as a result of the vascular pressure on the artery. So it could be annullated or abnormally dilated. Okay, the number four is thrombolism. That could be formation of intravascular blood clot on the brachial artery, which will lead to hypoperfusion of the upper limb structures. It is known as what? Thrombolism. Formation of intravascular blood clot, which is known as the thrombus. Okay, we have number five, which is embolism. In the case of embolism, those intravascular blood clots that was formed will dislodge from the initial site to another site, causing hypoperfusion. You get. So it is known as what? Embolism. The dislodging of the intravascular blood clot to a region where it was formed to another place. It is known as what? Embolism. So embolus will be formed in that place. Okay. The number six is coarctation. Coarctation. That could be tightening of the brachial artery. Maybe as a result of the compression of structures to it, it could be coarctated. Okay, so these are the arising clinical condition that is associated with the brachial artery. Okay, I believe we have done justice to the anatomy of the brachial artery. We have discussed it from the introduction to the clinical relevance. Endeavor to click the subscribe button and subscribe to my channel and anticipate for more videos like this. Thank you so much for watching.